And let's be the generation that finally, after all these years, tackles our healthcare crisis. We can control costs by focusing on prevention, by providing better treatment to the chronically ill, and using technology to cut the bureaucracy. Let's be the generation that says, right here, right now, we will have universal health care in America by the end of the next president's first term. Now is the time to finally keep the promise of affordable, accessible health care for every single American. If you have health care, my plan will lower your premiums. If you don't, you'll be able to get the same kind of coverage that members of Congress give themselves. When it comes to health care, we don't have to choose between a government-run health care system and the unaffordable one we have now. We'll invest in preventive care and new technology to finally lower the cost of health care for families and businesses and the entire economy. We must also address the crushing cost of health care. There's a cost that now causes a bankruptcy in America every 30 seconds. By the end of the year, it could cause 1.5 million Americans to lose their homes. In the last 8 years, premiums have grown 4 times faster than wages. And in each of these years, 1 million more Americans have lost their health insurance. It is one of the major reasons why small businesses close their doors and corporations ship jobs overseas. And it is one of the largest and fastest growing parts of our budget. Given these facts, we can no longer afford to put health care reform on hold. I am not the first president to take up this cause, but I am determined to be the last. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care. Now is the time to deliver on health care. I didn't choose to tackle this issue to get some legislative victory under my belt. And by now, it should be fairly obvious that I didn't take on health care because it was good politics. I took on health care because of the stories I've heard from Americans with pre-existing conditions whose lives depend on getting coverage, patients who've been denied coverage, families, even those with insurance, who are just one illness away from financial ruin. So I don't believe we should give government bureaucrats or insurance company bureaucrats more control over health care in America. I believe it's time to give the American people more control over their health care and their health insurance. I don't believe we can afford to leave life and death decisions about health care to the discretion of insurance company executives alone. So at stake right now is not just our ability to solve this problem, but our ability to solve any problem. The American people want to know if it's still possible for Washington to look out for their interests and their future. They are waiting for us to act. They are waiting for us to lead. And as long as I hold this office, I intend to provide that leadership. I do not know how this plays politically, but I know it's right. And so I ask Congress to finish its work, and I look forward to signing this reform into law. Now, it probably goes without saying that tonight's vote will give rise to a frenzy of instant analysis. There'll be tallies of Washington winners and losers, predictions about what it means for Democrats and Republicans, for my poll numbers, for my administration. But long after the debate fades away and the prognostication fades away and the dust settles, what will remain standing is not the government-run system some feared, or the status quo that serves the interests of the insurance industry, but a healthcare system that incorporates ideas from both parties, a system that works better for the American people. Now, I have heard rumors that a few of you still have concerns about our new healthcare law. So let me be the first to say that anything can be improved. If you have ideas about how to improve this law by making care better or more affordable, I am eager to work with you. We can start right now by correcting a flaw in the legislation that has placed an unnecessary bookkeeping burden on small businesses. What I'm not willing to do is go back to the days when insurance companies could deny someone coverage because of a pre-existing condition.
Here's what you need to know. I have strengthened Medicare. I have made reforms that have saved millions of seniors with Medicare hundreds of dollars on their prescription drugs. I've proposed reforms that will save Medicare money by getting rid of wasteful spending in the healthcare system. Reforms that will not touch your Medicare benefits, not by a dime.
So here's how this is going to work. We're setting up a new online marketplace where beginning October 1st, you can go online or talk to organizations in every state that are going to have this set up, and you can then comparison shop an array of private health insurance plans. You can look at them side by side, just like you'd go online and compare cars. And because you'll now be part of a new pool of millions of other Americans, part of this exchange, insurance companies will actually want to compete for your business, the same way they compete for the business of a big company with a lot of employees.
Many members of Congress in both parties are working hard to inform their constituents about these benefits, protections, and affordable plans. But there's also a group of Republicans in Congress working hard to confuse people and making empty promises that they'll either shut down the health care law or, if they don't get their way, they'll shut down the government. A lot of Republicans seem to believe that if they can gum up the works and make this law fail, they'll somehow be sticking it to me. But they'd just be sticking it to you.